Patient Safety Day. Thank you very much for your attendance. Before I say anything further, I would like to express the gratitude of the management of the hospital. We had to do this in a very short space of time, and what we have here is an excellent example of the commitment and dedication that our staff members show at all times. So thank you very much for doing such an excellent job in such a short space of time. It completely sums up what we are trying to do. Queen Nandi, we know, is a mother and child hospital. Our priorities are always safe maternal and newborn care. It is the basis of how we function. We serve and we protect mothers and newborn babies in 3 districts, more than 2.5 billion people. Our responsibility is so great, and we need to ensure that we keep to that responsibility at all times. And this is evident by what we see here. You know, just some statistics from the World Health Organization: 800 mothers die a day, 47,000 newborn babies die a day, about 50% of the under 5 mortality rate is newborn babies. It is important and it is imperative that we take this theme, which is Act Now for Safe and Respectful Childbirth, by ensuring that we have safe maternal and newborn care. So welcome. Without further ado, we are going to ask each component that has so wonderfully presented today to just take us through what World Patient Safety Day is first. Before we get there, I'm going to ask our quality manager just to give us a brief purpose of why we are here today. Thank you.
Colleagues and our patients, today we are commemorating a Patient Safety Day. On the 17th of September this year was a global or World Patient Safety Day. So as a mother and child hospital, it's of our best interest that when from the patient's journey, patient coming in to our hospital, we do all that we can to ensure safety of our patients until the mother delivers her baby and they go back home safe. So it's all in our interest. So this day is commemorating that. So as Dr. Samjohan has mentioned, that this is like a walk-through stations where they take us through from the patients, where the patient come in from our hospital, what happens, labor ward, until the patient reaches, until the patient delivers. After delivery, the baby may have problems. Then now need to be admitted to nursery. They will tell us at nursery what is it that they do. After that, we also hear about nutrition part of things, then farmers as well. So that will give them an opportunity to express themselves, what is it that they do on these stations. That's all. Thank you so much.
I'm Sister Damini OM in labor ward at Queen Nandi. In labor ward, we receive patients from our district hospitals. Some are from our local clinics. Some may come with complications which need urgent attention. When the patient arrives in our labor ward, they enter admission room. And then in admission room, we use the CTG machine. This is our CTG machine where we monitor the baby and the mother together, because here is where we're going to see the fetal heart. We're going to check the contractions. On top of that, don't forget the total physical examination of the mother. If the mother then is in active labor, the mother is going to be transported to active phase. In active phase, this is our delivery trolley. We have the PV pack. We have the delivery pack. This is the trolley. We have everything underneath. We even have oxytocin. Okay, this is our aid. Then, after delivery, if everything is well, if the mother and the baby are well, there is no complication. The mother is transported with the wheelchair, on a wheelchair, with the baby on together, skin to skin, to prevent hypothermia. Okay, this is the live mother and the live baby. They are transported to postnatal ward. Everything is fine here. If the mother has a complication, maybe after the delivery the mother had PPH. PPH is urgent. You call for help. Somebody is coming, they will put up the breath. Somebody will do the vital signs. Then the doctor must be called there and there. The second line is put up. The doctor will order blood, FTP, cyclopropin, oxytocin, whatsoever. The catheter must be already in before the doctor arrives. Okay. And then I will not expose my patient. Make sure there are no vaginal tears. You sutured everything. And then if the patient continues to bleed, maybe there is cervical tear. What do we use? Then we're gonna use our NAS, our pneumatic anti-shock garment. This is what we use to manage PPH. If the patient continues to bleed, even if we have used the NAS, the patient will be transported to theater for further examination. Okay, if the baby has a problem, then we're gonna take the baby from the mother, then to the resus. The baby is gonna be resuscitated here. Somebody must call the doctor there and there. 4563, the number must be here. We call the doctor will come. And then the baby will be resuscitated. If the baby is stable after resuscitation, you use your incubator. You transport the baby to nursery. Your equipment is here. Your oxygen is here. Everything is already prepared. Remember, don't forget to check HCT before you take the baby to use your connector. Use your, everything is here. Thank you.
Today I tell you what we do in the neonatal unit, and I must say that we are committed to providing quality service, quality level of care to our newborn babies. 1 in 10 babies are born premature, and it is our commitment to provide these babies with the best level of care. As you can see, we've got an incubator, we've got fancy ventilators, CPAP machines, and we use these services and facilities that we have to provide the best level of care. Now, in addition to that, we have a very dedicated member of staff, nurses and doctors. We have designed a pledge tree which tells us how we manage a preterm baby. We make sure they gain weight well, provide them with respiratory support and resuscitation, prevent and treat infection, support the mums of premature babies, maintain their nutrition, promote bonding, and ensure that they have good temperature control. So what we have done is many members of our staff are going to pledge what care they are going to offer to our preterm babies in this incubator. So our first pledge is, I pledge to give you the best medical care that you deserve. Okay, and the rest of my team will continue.
And I pledge to keep you warm, baby. Another one. And I pledge to protect you and keep you safe. I pledge to keep you warm, well informed the mom. And I pledge to love and care for you babies. I pledge to keep your home surrounding clean and safe. I pledge to support your mom. I pledge to be by your side all the way.
I pledge to intervene quickly in your golden hour.
I pledge to help you breathe.
I pledge to wash my hands.
I pledge to monitor you closely. And I also pledge to treat you promptly.
I pledge to feed you well.
I'm Candice. I am one of the sonographers in the ultrasound department. So with ultrasound, we provide antenatal and postnatal ultrasound for patients. We ensure that we keep a safe and comfortable environment for both moms and baby. With ultrasound, we're able to detect if baby's doing well, the growth of baby, whether there are any abnormalities. If they are, which we do refer to our medical clinic in the hospital, and then management is taken from there. But with ultrasound, we also show mom babies, to show mom that baby's doing well, and yeah, so we just provide a safe and comfortable environment for the patient.
Good morning, everyone. This is pharmacy, and this is how we ensure patient safety on a daily basis. So when you get a script from one of the wards, we have to make sure that the script is valid. By doing that, you have to make sure that the name of the patient is there, the patient number is there, the age of the patient, the diagnosis, the ward name, as well as the weight, because that's how we ensure that the dose is correct.
Alright. Okay, so essentially, this is what we're looking for when we look at a script. So firstly, what we do is we check the dose, we check if the dose is correct, we check for interactions. It could be drug-drug interactions, food interaction, supplement interaction, or medical conditions. So as Sim indicated, it's very important that on the script, the diagnosis is indicated so that we can check if the medication prescribed is indicated for the diagnosis stated. Right. So we also continuously monitor. So for example, when patients are admitted for a long time, neonatal patients, over time they gain weight and their weight changes. So we continuously check if the dose is adjusted according to the weight of the patient. We counsel patients on the medication that we give them. So if we were to give them this pump, we would demonstrate to a patient how to use the pump, right? And also with the smaller patients, they use a spacer. So we also demonstrate with the spacer how to administer the pump. And then most importantly is communication with the prescriber. So it's very important that we can see who prescribed the medication for the patient. The signature is important. It has to be clear and it has to be legible. So we use that to then communicate with the prescriber. For example, when a patient has been on IV line antibiotics for long, we question that and we ask why haven't we moved the patient to an oral form of antibiotic, whether it is a syrup or whether it is a tablet. So it's very, very important that we communicate with other healthcare workers to ensure that the patient receives the best care and the medication is safe. The medication, to ensure that safety is the safety of the medication, it is very important. It's vital that we don't break the cold chain. So it is very important that when nurses come to collect medication for patients and it is a cold line, it's important to bring a cooler box with ice packs. So one of the medications that we would give with a cooler box is phospholipid. This is Savanta or Surfactant. So this is used for respiratory distress syndrome.
Hey everyone. In terms of dietetics, we are looking at nutrition holistically. So we're looking both at the mom who's pregnant and then also at the newborn as well. So we are speaking about the healthy eating. So if you are eating healthily as a mom, you are giving nutrition to the baby, so the baby will be healthy at birth as well. And then you have incidences where like we're working with neonatal, so where there are prem babies. So in that case, we advocate dietetics, we advocate for breastfeeding, and also one of our achievements as Queen Nandi is also having our human milk bank, which then has the essential nutrients which prevent a lot of diseases, infections, and NEC that you might have in children that you're trying to prevent and not have at all. We also then look at, in a well baby, besides breastfeeding, we also look at then in the future as complementary feeding. After 6 months, we're looking at the types of food that a baby can have, your complementary feeding, eating from different food groups, different colors, then bringing in a lot of your nutrients in terms of your starches, your proteins, and your minerals and vitamins. So looking at a healthy mom, if there's a healthy mom who is eating healthily during pregnancy and post-pregnancy as well, if they're eating healthily, the nutrition that you get as the mom is also essential in giving the baby. If a healthy mom is giving, that's how we found well babies, and if you're eating healthily as a mom, the nutrition that you have and in your breast milk you will be well and sufficient and have all the nutrients in terms of vitamins, minerals, and other things that are essential that you will need for your baby. So our stand was mainly just looking at feeding and looking at the safety as well of feeding in terms of COVID as well. So regarding COVID, I know people have been scared. Should I breastfeed? When I had COVID and everything, you can still breastfeed because there are these antibodies that we get from breastfeeding, which are essential for the baby to then have as well. Thank you.
From the hospital management team and from the rest of Queen Nandi, thank you very, very much for everybody who was involved in creating such an incredible World Patient Safety Day event. It is of such a high standard at such a short space of time, and you've certainly excelled. Our aim always is to keep the name of Queen Nandi and the flag flying high, and the evidence is here. We've got an incredibly dedicated, wonderful staff component, and this is how we see it. So once again, from the quality department, from the hospital management, thank you to everybody for what you've done here today. And hopefully, at the end of this, we are all aware that mother and newborn care is going to be our #1 priority, and that's what we pledge to do. Thank you.